And then we'll have you turn over into supine. Very good. Now here, keep the towel. All genders. You're better suited to just have some additional coverage here. You know, it's and bunchy, right? Not tight against the body. It protects you, creates a level sense of comfort for them. If they need to adjust and all that, it's less, it will seem less like they're exposed. So I strongly suggest, even if they're like a tendency towards warmth, you can have their legs or their feet undraped and all that kind of stuff. But additional coverage here is a good thing to stick with, especially with your first few sessions with clients. As time goes on, and you know they're not crazy and all that kind of stuff, then things can get a little bit more, maybe a tiny bit more relaxed. I tell you to always be as cautious as you need to, but there we go. But, like for example, I dealt with a lot of scar tissue related to, it's gotten better now, but related to mastectomies and stuff like that, right? First time sessions with that can be a real sensitive thing to do. When I would work over clothing and kind of get a person introduced to the principle, work much higher up, and I go, now if you're comfortable moving forward, we can get more targeted on that scar tissue, but you need to be okay with that and everything. There's all kinds of emotion and sensation related to that kind of thing. So it's a way we're like trying to chip away at getting more aggressive, even with your draping, okay? All right. The pattern shows the abdomen first. So let's go ahead and follow that the way it's listed. Know that you could sprinkle that in at the end. But if we're doing relaxation, then I argue this is the better format. So instead of putting the bolster in, what I would have done is had the knees come up, feet flat. Now this is where this is so helpful, because now I can have this here. I'm not even gonna fully drape the abdomen for this approach. I'm gonna create just a little tiny window here, just enough for my hand to get under the lumbar region. Now, this hand ideally gets as close to the lumbar spine as possible, but do the best you can. Sometimes you need a step stool. This is a hydraulic table, but I'm gonna keep it fixed. And it could be one hand or two. Now, both knees turn toward me a little bit. That'll make it easier for you to get underneath. So a little window here. We're gonna do one more thing for your low back. Now this will introduce forces into the abdominal muscles, but we're gonna make it about the low back to start, okay? So then I get those body mechanics, both knees bent. I'm doing this. My forearm is compressing the abdominal muscles, while my hand is pulling on the lumbar area, okay? And then I just ask, now I can either passively, if I have the strength and the gumption, but I usually don't do that. Relax, get my hand set, and this could be two hands or one. I tend to feel okay with one, so I'm gonna do that, and I say, okay, turn your legs the other way. Remember how her hip orientations were kind of offset? One was too external, one was too internal. This is a way to just kind of have her do both and see if we can hit a reset button. Now, in these spaces, I could also have gone over the sheet, but I'm not gonna get that glide effect in the same way. Let's see if we can do it. Come here. It's where I can kind of make sure the sheet's in front of the wrist. There we go. Good pull. Okay, then rotate. And there we go. And good, come back to mid.
Now when they're all the way over, do you end up like on the side, or are you still on the back with your fingers?
Yeah, I'll glide all the way to where I was on the side. So I started all the way where I could feel her lumbar spine. I ended here. But her twist is what caused that glide. But it's a case where not everyone needs a bunch of abdominal work. But for low back related conditions, and these are big muscles related to breathing and core stabilization and everything, it's silly to not have an effective way to work on them. So here's me getting my hand, me set, leaning back, make sure the sheet is oriented well, okay? Okay, and rotate. And I just hold on, and she'll cause the glide. This one feels like it's a little bit more difficult to do. And that was my comparison. How did going one way feel compared to the other? Okay, good, come back. I'm gonna reset on this one, back underneath. Good, pull. Okay, rotate. Good, come back. And one more. As said, to pull this off, you may have to, compared to what I'm doing, lower the table, come back, or use the step stool to get higher and use two hands. Okay. Now, we'll go bolster underneath. Good. Sheet bunch, a little scoot towards me, good. Okay. This the feet untucked. Okay. Now, applied lotion too quickly, I will survive. Then here, if I do have a thing, it's if their quads are ever too tight, then defer to this orientation of starting more proximal on the lateral side of the body, use your palm, and just push everything down towards the knee. That's a more gentle approach, and incorporate more kneading, and that may be all you can do here for somebody that's very sensitive and flinching on that anterior upper leg. The rest of the time, what I do is this. That's my way of warming up the superficial layer. Now I'm thinking lateral. Vastus lateralis, and where it interfaces with IT band. Then I rotate the leg. Now I'm thinking rectus femoris, and underneath of it, rectus intermedialis, or intermedius. So with the grain, against the grain, I'm thinking about the muscle's anatomy itself. I can think, do I follow the grain structure and elongate it? Or do I go against the grain structure and try to bend it or even kind of shear it off of the underlying structures? Okay, then if I externally rotate the leg, keeping the sheet contained, now I can be more medial, and vastus medialis. Keep your hand in such a way where it's actually at the bolster. I could go, I'll end up going a little bit downhill, but I can get some of those anterior adductors as well. There we go. All of the lower leg stuff has been done, so we do not need to work on the lower leg. What I do need to make sure I address are the hip flexors. Those are usually pretty easy to find just because you can kind of see where the line of where the hip actually kind of meets the torso. If you have to, palpate up to the greater trochanter and identify that, or even find the anterior superior iliac spine. I can find that and the greater trochanter, and that's all done through approximation. But usually here, what I'll do is I'll kind of just rhythmically work my way up the lateral side of the leg until I identify more or less where that greater trochanter is, and then that's where I know those hip flexors are. Then here is where, from a passive standpoint, all I have to do is introduce a little bit of pressure on the lateral side of the leg, and that will cause the internal hip rotation. And most people need more of this. So if I default to anything, it's this. I compress the hip flexors. There's a whole group of them up here that attach. Rectus femoris, the top quad attaches there, sartorius, and then just adjacent to it, I moved. So here, I'm more anterior, just inferior to the anterior superior iliac spine. That's gonna get rectus femoris and sartorius. One is just a hip flexor. Sartorius is also an external hip rotator. If I go lateral to that, more kind of where the pocket would be in pants, then that's going to be tensor fascia lata. Now if I keep going lateral to that, then I'll get gluteus minimus and some of gluteus medius.
So on our muscle dummy, are you aiming for the outside ones or the inside ones?
Both. So right here, this thing, I'm aiming for, oops, sorry, that's not the compression we're looking for. I'm aiming for right here, and then a bit lateral. But there's the iliac crest right there. So see how sartorius, and then there's rectus femoris, and there's tensor fascia lata. Tensor fascia lata is the main muscle that controls the tension of IT band. So here and there, plus that joint movement. You can always get more aggressive, taking the leg off the edge of the table and putting that all in tension and working that way would introduce even more forces to that. But I'm trying to give you kind of the initial blueprint of just what to follow that'll work really good for most people. And even with hip arthritis, see, the bolster puts that hip in mild flexion, and the knee. So even with arthritic joints, this tends to gap those spaces and make it safe for you to introduce joint movement into those areas, even if it's just a tiny bit. So even with, falling into my pattern of getting the lotion applied too quickly, but here, let's say even the joint could only do this. It's still better than not doing nothing at all. So if I want to try to keep that joint from getting worse as slow as possible, it's going to be introducing that rhythmic joint movement, because as it immobilizes, that synovial membrane is not being stimulated and it's not secreting the synovial fluid to lubricate the cartilage. Oh, there was a ropey moment. So knees, and this would be where I pick where my pull and my push hand is. So this hand, I'm not going to go more medial and use that as my pull hand. So I make my knees all, my pull hand by the knee, my push hand more on the lateral side of the body. Okay? Now, vastus lateralis. Rectus femoris and vastus intermedialis underneath of it. Making sure I keep that sheet pinned to the medial side of the leg. Now vastus medialis, and maybe even a little bit the adductors. Good. Redrape. Roll. Come internally in. And rhythmically work my way up till I identify where those hip flexors are. Okay. And I just have to push. And that's how I'll introduce that rhythmic joint movement. It's just these tiny pushes. If I needed to, then I have the client do it, like rotate their leg all the way out and then roll in as far as this is comfortable, and then come back out and roll in as far as this is comfortable. And good. But that is an essential area to get good at working if you're going to do anything for anybody's low back and hip problems. So, gotta get good at finding that and working. It's not very complicated. Do it over the sheet, incorporate that joint movement. Now, if I were to kind of sort of generally pick which shoulder to work on first, it'd be the non-dominant arm. So, confirm with the person right-handed or left-handed.
Right.
I would have confirmed that before everything, and I knew that. That tends to be, the dominant shoulder tends to be the one that's elevated, tends to be the one with more tone, all that kind of stuff. So now, when finding their arms and draping this is where this can be helpful. Additional coverage here, keeping everything down on the chest. Find their wrist. Find their wrist, then I can untuck everything, and I can make sure the sheet gets put there on the side of their body. Okay, and I don't need a ton of space here. I'm not even gonna apply a lotion here on the pecs. Now to warm this up initially, what really my pattern tends to be is I'll come around and I'll do some rhythmic compressions here to warm everything up. It's using soft fist, kind of like a cat paw. I gotta find where the clavicles are. I'm feeling for those with my fingers. And I'm just pushing everything away from the sternum and away from the clavicles. And maybe in a relaxation session, this might be all I need to do. I could just do this. I could set myself up, and my pressure is going to be predominantly, let's say, on the left. And I say, okay, big deep breath in, and all the way out. And just kind of give the ribs a little bit of a nudge. Okay, then I change my pressure, have it be a little more focused on the right. Okay, big deep breath in. And all the way out. I could do a few cycles of that, and maybe that's all I need to do here. Usually people need more help with that. They have neck and shoulder related symptoms, then we need to affect this better. And this sets you up for if they have any kind of nerve impingement issues that are causing radiating problems down to their arm. This orientation sets you up to be on not just pec major, but pec minor. So all I have to do is, the camera can't see, but hand contacting. I just don't want to have my elbow coming up and potentially be on their clavicle. So here, and this could be over the sheet if I needed it to be, okay? And then just arm needs to go back and forth like this. Thankfully, you guys have practiced this plenty. If I wanted to get more of a stretch, then I let the elbow go into full extension. I can grab just proximal, just above the elbow, and externally rotate. And that'll introduce a bit more of a stretch on pec and pec minor, right where I'm pushing. Okay, I'm standing right here. And this is where I can introduce a torsion force. Now I do this in other areas, but this is just a good example. Instead of doing a push-pull with my hands, I'm gonna do the pull action with her body. And I'm still getting a torsion force in the anterior upper arm, things like the biceps. There's more stuff here. The cool thing is except for way up hugging the ball and socket joint, there's a muscle called deltoid, the real superficial one. Kind of sits like an epaulette on my dress stuff. Everything else on the anterior upper arm has B-R-A-C-H in its name. So coracobrachialis, bicep brachii, brachialis, brachioradialis, but brachii something. It has B-R-A-C-H in it. It's on the anterior upper arm. That's helpful. And coming to the forearms. You and the camera can't see, so I'm going to speed this along a little bit. Forearms are a great place to need too. If you're going to pick something, like sometimes if I have to shortcut, let's say the minutes are just ticking away and I'm like, okay, I gotta speed this up. If I can knead an area, I'll do kneads because it's introducing more forces into the tissue. Okay. Okay, hands. I start with kind of using my fingers, like little pinchers. Work my way up, then it's going to be thumb and pinky fingers, so first and fifth phalanges. Then index and ring finger, or second and fourth. And then thumb again, because it's so important, with the third phalange or the middle finger. Good. Then when I re-drape the arm, I gotta make sure there's some over the upper arm when I set them back in. If their arms are ever flopping off the edge of the table, if you have a very narrow one, then you can always kind of tuck them in underneath. I'll show that more on that side. Okay, coming around. We've already done the soft fist, which would be what warms this area up. When I come here, search for that wrist, found it, then I can make sure everything's there. And as said, worst case scenario, just go over the sheet. And I don't need a whole lot. I usually just kind of nudge that, I create that big wave and bunch. I just nudge that out of the way with my forearm. And then I'm where I need to be. Okay, hand contacting table is helpful. I don't know if you can see very well. That keeps me oriented well. You want to feel like you're on the ribs. Don't be up on the joint line of the shoulder, and don't be up like this. Okay, pressure.
Good.
Little rotations. Arm down, and I can just grab the whole, like right around at the elbow, and just roll that. See, I turn the palm up into supination. That's also externally rotating that shoulder and creating a good stretch right there in pec major, pec minor. If there was more going on here, it's not like we couldn't come in, and I usually over the sheet do this, come in and be more targeted. Certainly could, don't necessarily need to do that for everybody. This is where we can do that push-pull. I usually do this a lot even on the hamstrings in prone. Okay, down. There's a thing happening here where instead of gliding up, I'll have this pull hand be causing those tension forces with the grain of biceps. I need to be more thorough on the forearms. Then instead of your forearm, the palm, you kind of find where the elbow joint starts. It's really where we're looking for the radius. I can set my hand right there, just inferior to the elbow, sinking good and strong, and then just slowly track downward. You're going to incorporate, you're going to change up your pressure, and then this would be where, you know, anybody with forearm, wrist-related issues, hand-related issues, this right here, this is the posterior part of the forearm because she's pronated. Really important area because supinator and a bunch of crazy structures overlap right there. There's that, or there's introducing all these needs. Okay. And here, kind of doing this. First and fifth, fourth and second, third and fifth again, and there was a pop. Happened on its own. It's okay. The only thing you need to confirm if a pop happens is it didn't hurt. If it didn't hurt, everything's okay. If it did hurt, don't do that again. All right. Now here, to close down the session, if I have access to a stool, that would be preferable. I also didn't show in the routine, but we could have used this for a shelf for the hands while I'm prone when I reposition the arms above. Okay, so sanitize. Now, some people like to leave the pillow in because it keeps the cervical spine a bit in flexion, which is a safer position for it. As long as you don't do a few things, I tend to feel like it's easier on you to get that out of the way. So I'm gonna have you just lift your head up for me. I have to untuck the hair, then I can let it relax. And relax. Now I can control, get this out of the way. getting the hair out of the way is an art form here. And so I tend to, I'm cradling with one hand, drawing the hair up out of the way. And this can feel good. So cradling and drawing up. To the mildest of traction force, I'm gliding on the back of the neck, the cervical area as I do this. So I can make this turn into kind of nice rhythmic thing that feels good. If I curl my fingers more, I can start like kind of applying pressure into the erector spinae and have more of a sensation. But my goal here really is to get the hair out of the way. Then once here, if we needed to do extra work on the upper traps, hand right on the table, you can't miss. So come around the side. The angle's not going to show well, but I could same thing and turn the other way. But see how much on an angle I am? Now sitting here and trying to apply forces. I'm going to get a better effect this way. This way too, I could even use the softness to come up into the cervical area a little bit. So I'll show that over here. From here, see if I can create good angles for you to see. Here. And here for the neck as well. Not my preferred way to do it, because I've got all that in sideline really good. But I can work on it a little bit more here using softness. Or what I tend to do, you can't see it, so my thumb's on one side, but my fingers are curled like this. And that's how I'm going to create either a more targeted effect. So I find the spinous process, and I go just lateral to it, and my pressure is going to be more straight up. And just hold, don't push their head down. You do not want to be causing this. Don't let their head tip back. If it happens a little bit, you're fine, but if you do any kind of traction or anything on the head, the most unsafe position for the skull and the neck is like this. So try to keep them a bit more flexed as you work your way higher up. It's more important if you're doing traction, but I would tell you to avoid doing traction here. So here's where I can either have the pressure be this, or I can come around onto the side of the erector spinae, curl my fingers more, and pull in like that.
So what if you're kind of walking your fingers, you know, behind the head? Sometimes it just, I think, naturally.
Yeah.
Is that okay?
If it's tiny, sure.
Okay, just not like pulling.
Where
right?
it goes, yes. Where it goes bad is people do this and then they pull.
Right.
Okay.
But if you're just kind of massaging and walking.
Oh yeah, that's
like that.
yeah. And here, when I do that, ideally have their head cradled a little bit. It's most important if you were to introduce any kind of traction force, which I'll show here at the end, but it's going to be this, not that. See, she's able to do that, and the table's there as a buffer. It's a case where you would have to fight really hard to cause damage, right? Like, we're not doing crazy stretching of the neck or like trying to crack the neck, stuff like that. That's where the bad stuff happens. I'm giving you like extra buffers of safety where it'd be like near impossible to cause anything. But this is where I can do that additional thorough work. Somebody has a specific neck thing. They have like that kind of nasty spot related to a tension headache, all that. I've done good work in sideline. What's one more little thing I could sprinkle in to be more targeted? And this is where I really need to save my hands though. As much as I'm using all these mechanics, I'm still having to engage a lot of my forearm muscles to pull this off. But I can find a really good spot and hold that. And that more targeted pointy pressure here can feel fantastic. Like if I have a place where it's all the tingles and radiating referred sensations and stuff, I get it when you work on my neck, especially over the base of the skull. Once you get up to the base of the skull, really initially, all you need to do is follow where those bony bumps and ridges are and apply pressure just a little bit inferior to those. And just follow them all the way up, even behind the ear. You can apply like nice little pressures back here. Nothing too aggressive, but little holds and kind of holding in this direction. There's a big mastoid process back here. If you look behind your ear. Feel behind your ear, you'll feel that. I can pull up into it, push it down and away, or towards the posterior area, maybe pull it back up this way. That's where I could do it. Now I've already done that with my forearm and sideline again. So I'm gonna balance her out a little bit. You can't see it here, but just the right side of her neck relative to her dominant shoulder will be the one that tends to have more stuff going on. But still do at least a little bit of it on the other side to balance it out. Better would have been for me to have worked on the left side first. Okay. So all that can be something that feels really good, even if you just kind of do that generically up and down the cervical area. This is where doing a mild traction can be nice, but I'm just gonna put her cervical spine and head right here between my hands. I'm gonna brace my forearms against the table and lift up like this. So scoop, scoop, here, then forearms down into the table and lifting up. Make sure I'm not tucking here. Out the little hair, I move that out of the way. Okay, set, and then lift up. And I try to get their nose and chin oriented with their sternum. And then I just wait. And the glide slowly happens until I'm up at the base of the skull. And the one time I use my thumbs, just a little bit of a squeeze as I go back down. And I might reset and do that again. Scoop, scoop, push, lift. See how the chin's going down? This is very safe, and I just wait, and I wait, and I wait. Going down. A little swoopy. And then here. A little bit of work on frontalis. You'll learn these muscle centers as occipitofrontalis. So there's muscles just above your eyebrows. We're all about making frowning faces and surprise faces. Following a facial or even a lymphatic-based approach. Compression down, and then out and away is predominantly the pattern you want to follow. Out and away from midline. Compression, out and away. And if I'm going to do anything more here, sometimes like I'll have my fingertips work on temporalis and I'll visualize the suture line and I'll just kind of walk that up. Another brush. Cha. I do not make that noise. Contact with the shoulders. Contact with the legs and knees. And then you don't have to do the brush off. It's stuck in me from polarity. And there. And then knees up. All right, all set. I'll meet you outside with a glass of water and we'll get you scheduled for next week. Done.